Hi, everybody. I'm Jennifer Perkins. I'm a, marriage and family therapist, and I'm a counselor here in Australia. And I'm going to be talking today with Dr. Peterson. We're going to be talking about working with critical incidents and self of the therapist. Dr. Peterson, you want to introduce yourself?
Sure, I'm Dr. Colleen Peterson. I'm also a marriage and family therapist. I am the clinical director and assistant professor of marriage and family therapy at Utah Valley University here in Orem, Utah. Um, let's see what you want to know a little bit more. I have a PhD in marriage and family therapy as well as a master's degree in marriage and family therapy. I've been teaching marriage and family therapy for over 21 years now. Love it, passionate about it. Yeah,
And the burning question on everybody's mind right now, it's Christmas time. Do you have snow?
we have snow in the mountains. Like a week ago, we had some snow down in the valley, but it didn't stay.
Oh, that's a shame. Um, okay, so I'm thinking that we're just I've got some questions about some critical incident stuff that's happened. I know that you guys just had a major incident happen. Can you talk a little bit about what happened and kind of what your role in this was?
Yeah, so here at Utah Valley University, we had a shooting of a guest speaker here on campus, Charlie Kirk. That happened September 10th, I believe it was. Um, yeah, so I was here on campus. My students were here on campus. The the students were on a break. I had just been up to what we call the Hall of Flags, which overlooks the courtyard where the event was happening. I had just left prior to the shot going off. And no sooner got down to my office, my building where my office is right adjacent to the courtyard. And so as I was getting to my office, we went into lockdown, knowing that there was an active shooter, but not knowing the extent of the active shooter.
Okay, so as a therapist and supervisor, you were right in the middle of this incident. It happened in your space.
Yeah, it happened in our space. I had just passed three of my students. They were going the other way. And then one of those students whom I had passed came down and was in lockdown with me in my office. Um, so just trying to help keep things calm as we didn't know what was going on with the active shooter on campus.
Okay, that sounds really, really terrifying.
Yeah, it was pretty scary for the students. My next door neighbor, office mate, had several students as well. And our office is right off where the stairs come down. So the overlook of the courtyard, you have to come down from that because it's up on the floor above us. And so like a bunch of students were coming down. My office mate, she actually had there were some high school students that happened to be on campus and
Oh
they just
no.
pulled in with some of our students into her office as well. So,
Okay, so you went through this, and then you had to be the therapist and supervisor dealing with all the students going through this.
yeah, so I really wasn't in a therapist role per se, right? I was more as a supervisor and a faculty instructor. But yeah, so we went into lockdown, and they were just like, get out, get out, get out. So I piled like six or seven students into my car. I have privilege as a faculty, right? Like I have parking right there by the building, but the
Mm,
students were way on parked on the way other side of the building. So I was like, just pile in my car. I'm going to take you over there to get you to your vehicle, get you out of here as soon as possible.
okay. So that sounds really terrifying, by the way. So you're right in the middle of it. You experienced the whole thing, and then you gotta come back and help these new therapists get through this ordeal. And uh, still work in the center. Did you guys close the center down? Did you have clients
Yeah,
coming in?
and they had to like notify clients to not come into the on-campus clinic.
Uh,
Um, yeah.
did they have to
So
work online, or did you guys give
no,
them
so the
time off?
university was actually closed.
Mm,
The university closed for about, it was closed. It was tiers and it changed, but it was closed down for at least those 2 days because it happened on a Wednesday. And so initially we were just going to be closed, Thursday and Friday, but then they extended that period of time and did a gradual kind of bringing things back online. So students didn't come back till the following Wednesday, but faculty came on Monday to try to prepare for having the students come back to campus.
okay. So so you're preparing for students, but it's also as like a supervisory role, right? You're preparing to how do we help how do we help these therapists get through this? So what were some of the things that you did? How were you able to, what were some of the decisions that were made? What was the plan that was made?
Yeah, so for us as MFT faculty, we decided that we didn't want to have students talking about it in each class. So we decided that the first time in the morning when the students came back, we would all meet together and give them an opportunity to process what
Mm,
had happened, be able to address that with them. So we have a cohort model. So our first years are on one day, on 2 days a week, right? And then our second years are on another 2 days a week. So for both of those groups, they do a morning class and an afternoon class. So the first time that they were coming back to campus, we met with them, all of the MFT faculty and the students, to have an opportunity to process their experiences.
mm. Did you find that everybody kind of dealt with it the same way, or did you find what was your findings?
So what we found was everybody had a different response. And as with any trauma, a lot of that is determined by their proximity to what had happened and
Mm,
their own kind of trauma experiences in the past. So we had one second year student. So if this is the hallway, the speaker is here. There's a building across the courtyard where the food court is housed. And one of our students had gotten something to eat at the food court and was actually walking across the courtyard, coming back to the
oh,
building at an afternoon class, actually practicum supervision. And he was actually in the courtyard when the shot went off.
oh,
And so for him, I would say he probably had some of the most adverse responses to that because he just started running because he was afraid for his life and
mm,
didn't have any shelter being in that courtyard, not knowing if there were going to be more shots coming off.
mm,
Uh, and so for him, he was, scared to death. He actually ran across made the major intersection and went over to a Walmart and,
mm,
was trying to call somebody to come pick him up. Um, and then we had other students, right, that had been there observing up there in the Hall of Flags. There were others who were in the student lounge area who were eating lunch, but then were funneled into like lockdown. So a lot of different experiences with that. We had some students that had extreme fear coming back, extreme anxiety, even thinking about coming back to the campus
mm,
because safety had been, so jarred by that experience because it's our space. I mean, it's a second home, so to speak, for all of us who, are here and involved in that program. The other thing, though, that I did with my colleagues, and not just our MFT colleagues, but our social work colleagues, was I wanted the students to have it be a different experience coming back to campus than when they had left, right?
oh,
And so I had the idea to get my colleagues and we went and got construction paper over at the department office because they keep green paper. Green and white are the primary colors for UVU. And so we had gone the college that first day when it was just faculty and staff back on Monday. We'd gone over to the college office because they were having a little gathering. And then we stopped by the department office and picked up 2 shades of green paper And then we came back and we cut hearts.
Mm.
We put hearts all over the entrance, the hallways, the student lounge, down the halls to all the faculty offices, down the hall to where the classrooms are, and in the primary classroom where we have that. And then we also made three large banners, signs for the students. And on the one, we were able to let the faculty and staff have messages to the students. And so I was in Las Vegas when we had the shooting in Las Vegas as well. And one of the sayings that
Mm.
happened out of that time was Vegas strong. So one of the signs that we had there at the entrance was UVU strong.
Oh, right.
Because it was like we wanted to claim our space back. Like we've been, violated. And so those were the things that we did. And it was actually the feedback that I got from several of my colleagues, like it was very therapeutic for us too, because in some ways we were changing the space for us as we're trying to think
Right.
about how can we be there for the students, right, as they're coming back after this pretty traumatic experience.
That's something that I was thinking of too while you were talking about this, that there's there's two things happening. Um, and leave it to the behavioral health team to like understand the importance of this, right? That not only is, what can we do for what can we do for our students who are coming back, right? What can we do for the people who have also gone through this, who we have care over, but also what is it that we can do? We have to be able to do something. And so you and faculty, you found something to be able to do, to be able to like help through this incident. Because I'm finding and I'm hearing as I work more with critical incident, that it's important to be able to, everybody wants to be able to do something. I need to be able to do something. I need to be able to help somewhere. I need to be able to, give my gifts. How do I do this? And that was a faculty way of how to do this, which is how lovely. That's
Yeah.
really nice to be able to write notes to your students and also be able to that's brilliant, be able to change the space. Sounds like you
Yeah,
nailed
and
it.
the students were moved, right? And one of the big signs was, we're glad you're here. We love
Mm,
you. And that's the big banner, right? The faculty put notes on. And so it was right at the entrance to come in. One of the things that was also challenging was our building is considered an entrance to UVU.
mm,
Um, part of UVU, the design is that all of the buildings connect both for accessibility, but also in inclement weather. So
mm,
once you're in the building, one of the buildings, like you can pretty much get anywhere from anywhere else. And our building is considered one of the main entrances because there's like
oh,
you first come on campus, there's a roundabout there, and ours is one of those first buildings that come off of that. So we have a wall, it's kind of an angled wall that we put that on, and the students read those messages when they first came,
oh,
which I think was really important. And like we weren't standing around watching that, but as we were about our business going to and from, like we could see students, and I saw students who were moved by it, right? Like they were in tears,
mm,
because it was like they felt that love and support without us having to be physically there when they first came in, right? It sent a
mm,
very clear message, and with the hearts. The message that we were trying to convey is like you are cared about, you're seen, right?
mm.
And I think that was really helpful in that
Oh,
process.
yeah, that's really nice. So So after the first few days, you've as a supervisor, you're having to work with these new therapists. What were some of the things, how were some of the ways that you helped them through this? What was some of the things that surprised you?
Well, one of the first things that I did is one of our social work faculty who works with critical incidents, she does a lot with
Mm.
first responders. She had provided us all with a handout of trauma responses.
Oh,
Um, and as we were trying to talk as a faculty about how we wanted to manage that, I had said to the faculty, it's going to be really important that our students understand like what's happening with them, right? Because I mean, although like the irony in all of this was the class that I taught Wednesday morning right before the incident is an individual therapy class with a trauma focus, and
Mm,
we had just covered trauma that morning. And I was like, they need to understand and be provided with just some understanding of what the normal, typical responses are to a traumatic incident like this.
mm,
And so part of that was to provide them with this list of trauma responses, and just like helping them understand that everybody experiences it differently and how they experience it is okay. And so we gave them an opportunity to just kind of talk about that experience. And so
mm.
most of the students spoke, right? And then what was curious to me was after we'd done that, um, they asked us to share what our experience was like and how we were managing it, kind of as a way to model for
Oh,
them how to manage our own kind of trauma responses in that. And so each of us on the faculty did that. Um,
wow, was
you
that a
know,
really honest moment?
it was really honest. Like it was, and for me, so it was really kind of, it felt very vulnerable for me because I had my own trauma response having just been there. So, right, like I just missed witnessing
Mm,
the shooting. But then I also have my own kind of gun trauma because as a full-time clinician, when I was working in Arizona, I had a suicidal and homicidal client pull a loaded gun
oh
with me
God.
in session. And so for me, right, some of that trauma was activated for me. And so I shared that with them, right? And part of what we really teach our students is that, right, number one, they've got to be self-aware and monitoring themselves for their own kind of processes.
Mm,
But then they also need to attend to that. So I talked with them about how it activated me and that I had, engaged in that. I talked about how after I dropped all the students off, I didn't want to, I live alone. I didn't want to go home to an empty house by myself.
mm,
And so I called a couple of friends who are stay at home, right? They work at home or whatever, and found somebody that I could go be with. Like I didn't want to talk about it, right?
mm,
But I just wanted to not be alone in that because at that point we still didn't know what was going on with the shooter, or what the circumstances had been. So I talked about that. I talked about my, how it activated my previous trauma, and that's pretty normal, right?
mm,
For that to happen. And then I talked about that, I was in the process of getting into a therapist to do either some EMDR or some ART because I knew I needed to clear that activation so that I
mm.
could be present and, do what I needed to do to be there for them.
Wow, that is a really that's a really vulnerable story that you tell, and especially to people going through this experience themselves, that it's we're all just humans, right? We're all just humans having our personal story, our personal experiences, and as therapists, we often, like, hey, I gotta handle this, I gotta handle this. It's, I can't bring it into the room, but everything's coming into the room. And it's really important to be able to, have that piece of you that sees, wait a second, there's this stuff going on. I really have to handle this stuff. It's not okay to be, I can't just say I'm gonna barrel through this. I can't just say that I'm going to manage through this the best I can. I actually need to sit down and talk with somebody, get some support, no matter what that is. It's important to you're not supposed to be the strongest person on the planet Earth. Model what
Yeah.
you tell your
And,
clients or what you tell
and,
your
and
supervisees.
exactly. And that's like the feedback that we got from the students was that that was really helpful to them, right? That we allowed ourselves to show our humanness, right? And to get a glimpse into how we do our self-care as the self of the therapist, the
Mm,
self of the supervisor. And they found that very validating, very comforting to them.
mm. Yeah, that's a lot of gun violence in your history.
Yeah, I mean, yeah, that is a lot of gun violence, and I hate guns.
Yeah.
And so, I mean, part of it for me, like after that experience with my previous client, my niece was married to a police officer, and they'd heard my
Mm,
story of this, and he was like, "Aunt Colleen, like I'm gonna take you to the gun range so that you can, get over this." And went to the gun range, and I shot his pistol one time, and I was like, "No, right? Like, I don't like this. I don't like having that
mm,
lethality in my hand. I just it goes against who I am as a person." And he's like, "But and Colleen, like, what happens if somebody comes in and has a gun and is threatening you? Like, what are you gonna do?" I go, "I would rather die myself,
huh,
right, than be the source of taking someone else's life." And so that's kind of that's based on my trauma history, right, with
mm.
a gun in the room, but it's also kind of goes with my ethos and my ethics of value in life.
Yeah, right, right, right. That there's
Maybe more than I should be sharing, but that's for me, that's all intertwined with that.
right, but
And
that's kind of the point is everybody has a personal story with what's going on, right? So we're talking specifically about the gun violence and the hate crime that happened at Bondi Beach, but everybody has a story with about violence or hate crimes, or everybody has a story about this. Everybody, we know somebody, or we've experienced something, or we have clients who have experienced something. We all have a story that we could sit down and write about this, about how it affects us. Because it affects us, we need to be aware of how to handle this well, how to work well with this, and not pretend like it doesn't affect us.
yeah,
We are part of
absolutely.
this world.
Yeah. And like in full disclosure, I was doing my PhD at Kansas State when the Oklahoma City bombing happened. And
She's Colleen.
and so and my
How many disasters have followed you?
and my best friend actually was a professor at Oklahoma State when the bombing had happened, and
Mm,
we both had been involved in receiving Red Cross disaster training, mental health disaster training, and so we were they were asking for folks to come and help, and so a week after the bombing, we were there working with
mm,
the families, and it was actually we were there the day that we were working with families when they came in to say that they were shifting it from search and rescue to search and recovery.
mm.
Uh,
For
uh,
the Australians who don't know the story of the Oklahoma City bombings, where forgive me, but they bombed a federal building, but it was also the site of a daycare.
yeah, so the daycare was right at the front of the Murrah building
Mm.
where the bomb went off, so there were a lot of children involved.
Oh, okay. So those are the families that you're working with.
Yeah,
Yes.
and family members, right, who had of folks who were working in the building
Oh,
when it happened. Um, and it's not when I so part of the reason why I'm teaching the class, right, on individual therapy with a trauma focus is because I have that blue or the Red Cross training, but there was
mm,
also an organization by Charles Figley called the Green Cross, where they were training people to go in after these incidents, and I was actually trained in that prior to the 9/11 incident.
mm,
um, and so I have some familiarity with that. And when I'm talking with folks, right, it's like having that capacity to hold hard things. And you're
mm,
like, "Oh, Colleen, like you've been through all of this, right? How much of this has followed you?" And it's like, yeah. And also like my personal and professional capacity to hold hard things with clients
mm.
is also bigger because of that.
Oh, So let's talk about some really practical things that a supervisor or a therapist can do when there's something awful that happens. Um, just off the top of your head, what's some practical things to like watch out for, look out for, check into? What do you have off the top of your head?
So off the top of my head, I tend I tend to be pretty pragmatic in
Okay.
my approach to things, both with my students and also with clients. And one of the things that I find really helpful for that is just helping people with some psychoeducation to know like what are these common trauma responses,
Mm,
right? And it was like, so for instance, when we provided this sheet, right, it's got two sides, but it's like the first one is, right, it's descriptions of what the mind and body may experience during the crisis,
mm,
right? And then like what the body mind would experience, and then the emotions and how there might be relationship impacts following the crisis, right? And then like some information about what kinds of self-care is helpful. So for me, right, it was like what we did with these students was we gave them this handout and said, we just want you to have a chance to look at this, right? And one of the things I love about psychoeducation is that it really normalizes the process for
mm.
folks, right? So that it's like, this isn't within the realm of what we know happens when these kinds of things are going on. And like just to watch the students and they're like, oh, wait, yeah, that explains that I experienced, or oh, like I didn't realize that, that withdrawal response, like I didn't want to talk to anybody, that was a common response to that as well.
Ah,
Um, and that the sleep problems, right? The the impact on their digestive system, like
mm.
there's all these different kinds of responses, the numbing, right? Those kinds of things. And it was really helpful because then they had some words, right, to help them begin to describe what their experience was and how they were feeling and how they were responding. Um,
I'm also hearing you say that it's actually having the piece of paper is helpful too because you can say the words, but there's sometimes a distance because people don't aren't ready to hear. But having that on a piece of paper, something that they can look at, touch, take in their own time, that's pretty valuable.
Yeah, there's that concrete piece of it, and it's
Yeah.
less threatening because they're not having to look like inside totally. They're looking outside and kind of reflecting, which
Okay.
yeah, is
So
really valuable.
handouts. Yeah.
Yeah, yeah, and then part of that also is I think that modeling, right, and having it be an okay space. So we were actually I think I can say this. We went a little contrary to what the university was saying that folks needed to do, should be doing with students when they came back, because the word from the top was, we don't want you talking to students about what their experience is.
Oh, wow.
And like in some ways I can get that, right? I can understand that because like from like we're a small group out of a large institution. There's 46,000 students enrolled at UVU, right? But they're not all equipped to deal with
No,
trauma.
no, no. A
We
physics
are, right?
professor is going to
Yeah.
talk
Or
to
the
students in a
engineering
very different
professor,
way.
right? And so, but we knew based on our own experience, right, our own training, our own understanding of trauma, like it was like, no, we got this, and we're gonna do this, right? Um, and and I think that was beneficial to our students, hugely beneficial to our students.
Being able to talk about it.
Mhm.
Mm,
Especially so soon after it, right? Like their first time back on campus, right? To be able to have that conversation with folks, right? Like there was one of us MFT faculty that was not on campus when that happened, but the rest
mm,
of us were all here. And they're like we jokingly talk about trauma bonding, but sometimes as a negative thing.
uh,
But in this situation, right, there was a knowing that happened that created an alliance between us and a safety. I
Mm.
think that they were able to, as we were modeling, talking about it, they were able to open up and share about their experience. And then it was a nice reminder for us, right? Because I teach ethics and we emphasize self-care throughout our program, but they're trained in it specifically in the
Mm.
ethics class. And so it was an opportunity, right, to then have a conversation about, okay, so how do you manage your trauma response in all of this? And what does that look like for your self-care? Does that look like, hey, you know what? Like the university is providing resources for mental health. Does that mean if you don't have your own therapist, like taking advantage of that? And also just really encouraging them, like what we know with trauma is the sooner you process that, the greater the chance that those lingering impacts of it are going to be impacting you.
Okay, so I hear you saying that if there's a like an agency situation, like you're working in an agency, that you want to have the space that the therapists are able to talk about the situation that's affecting them. Maybe maybe turn that supervision, that group supervision into like a place of support, a place to talk about this thing specifically. Let's hold off on client cases. This is how we actually support the therapists.
Yeah, so it was interesting, right? Because we have an on-campus community clinic that our students see clients in.
Mm.
And initially the admins were like, hey, like let's have your students be seeing these other students that have been impacted by it. And we're
Oh,
like, whoa, 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 whoa. Like, no. Like these need this other students, right? The other UVU students, they need to find those resources out in the community. Our students who have been impacted by this themselves are not in a place, they're too beginning
yeah,
to be able to know how to manage that or do that. And so we felt pretty protective of our student therapists. We're like, no, like
yeah,
if they feel like they're ready and they're okay to continue to see the clients that they already have with those presenting problems, like that's okay. But we also, as supervisors, right, in our practicum settings and our group supervision settings, we had to start being mindful because it impacted the community too. So even if they
mm,
were seeing clients that were not students at UVU, or who were not on campus for the event, right?
mm.
There's that broader impact on the community. So we had to work with them to help them prepare to, right? Like, how do you manage your own stuff if your client's coming in and talking about it?
Mm. Right. That's so great question. How do you manage your own stuff?
Are you asking me personally?
For you personally, well, how would you help
Yeah,
somebody if they're
so I
asking?
mean, for me personally, right, and that's what I try to again model for the students is I talk about having to have a way to compartmentalize your own stuff,
Mm,
right? So it's like, and for me, I talk about that it starts with that awareness, right? And so, for instance, I'm gonna shift to a different topic, right? But it's like for me, I'll talk about grief and loss, right? And I'll talk about if we have our own history of grief and loss, and we're in a session talking with a client about grief and loss, and we find ourselves thinking about or feeling something related to our own, it's like
mm.
you gotta be able to recognize that.
Right.
And I talk about for me, right? It's like I'd be like, oh, Peterson, there's your grief and loss related to your father's death. It's coming up. Got to put it over here.
Mm,
Come right back to the client. It's like, I'm putting it over here. I got to deal with that tonight. Obviously, I've got some more work to do on my stuff, right? But then coming back to the client to be able to stay focused on that.
right. I
Um,
kind of
and
I kind of look at that as in the room, I sort of see myself looking at the room and at the client and at myself and being like, oh, whoa, that's a little bit of a surprise. I didn't see that happening. All right, stick that aside. You
yeah,
gotta
it's
you
that
gotta do
ability to
something about it.
recognize that with a meta stance, right? And it's
Yeah,
like, whoa, this is right. It's all happening, right?
right.
And Yeah,
Sorry,
that's
I
a great
interrupted you.
analogy.
Mm.
No, I interrupted you.
So as we're talking about practical things that we want as supervisors, um, that we want to be helping our supervisees with, or us going through it ourselves. Um, I'm hearing it's that peer support is really important. That
Oh, absolutely.
yeah, finding the time to make room for that, and encouraging your people to get with that.
Yeah, so one of my colleagues here had also been at in Las Vegas when the mass shooting in Las Vegas happened,
Mm.
and she actually had had a referral source for clients that were entertainers in Vegas who had actually been at the event.
Oh
And
no.
so she saw a lot of clients who had been impacted by that. And so for her, like she was activated
Uh,
very, very strongly. And to be honest, right, like a lot of folks don't know how to manage trauma. Like there's been a lot of like emphasis in the last probably 10 to 12 years, right, on this trauma informed care that's
yeah.
not just in mental health, but in the schools and other places as well. And so there's a lot of that, but in some ways, I don't want to be disparaging of our institution, but they didn't really do a good job. Like they were so focused on the students that they didn't really acknowledge or take care of, like how can we be
Oh,
supportive
yeah. Okay.
of the faculty and staff.
Right.
And so we happened to have a faculty meeting already scheduled that day when we first came back. We'd had like a meeting with the president of the university and the provost. Um, and they like skipped over us and went straight to taking care of the students. And it really
Mm,
activated my colleague.
mm,
And then we went into a department meeting um, and our dean and our department head were awesome. But they're like, how can we be supportive of you? Which it was like, okay, because we were like, we don't feel supported. And so then they were like, okay, how can we be supportive of you? And I sat next to my colleague who was very activated, and I just put my hand on her back, right?
mm,
Because it was like she was like all the flooding, right, was just present.
mm,
And then so she provides on-site supervision in the clinic,
mm,
and and she's like, I can't do that. And I was like, I got you. Like you won't. I'll cover that for you, right? Like I have the capacity to provide that on-site supervision. You go take care of you,
mm.
right? And I think that's really important, right? That we recognize our own limitations, like you alluded to earlier, right? Like we like to think that we're superhuman and that we've got to do this and take
Yeah.
care of things, right? But it's like it's that piece of being there and relying on colleagues when it's like I think I'm maxing out, right, at my capacity to do this, and for us to be able to then support each other in that.
Yeah. Right. And I also see you saying the importance of watching out for others. Right. Because sometimes we don't know where our limits are, and it's nice for people to come in and say, I got you. I can do this. You don't have to say yes to everything, or you don't have to
Yeah,
agree to this. I can see you're struggling. I got this.
exactly.
Okay, so I got four practical suggestions, and we probably have a couple more. So
Okay.
a concrete handout, get the peer support started, watch out for others, and know and recognize your own limitations.
Mhm.
You got anything else you want to add to this?
Yeah, and I think part of that too is helping to create an atmosphere where it's okay to talk about it, right?
Mm,
Um, because what we know is, right, everybody has their own trauma response and it shows up in different ways and in different times. And so if there's an expectation, right, like, oh, like, hey, like this is 2 weeks past, like you should be past this. Like, no. Like
Mm.
whenever you recognize or see it or feel it, right? And that may happen at a different time and in a different way for everyone. And allowing space for that to be, I think, is really, really important.
Okay. So then it's okay not to be okay. Yeah. Okay.
And to ask for help, right?
Yeah, I like you right. So creating the culture of it's okay not to be okay and ask for help.
Right. So that colleague, right? So I covered 2 nights for her, and she thought I'm going to be okay the next week. And then she came in, and something else was triggering,
Mm,
and she's like, "Hi, this surprised me. Like I thought." Right. So she'd done an EMDR session and had felt like she was cleared and ready to come back. And then
mm.
there was something that happened at work that was triggering. And when she even just started to say, like, "Oh, this surprised me," I'm like, let me cover you another night, right?
Oh, wow, wow. And we just have a few more minutes. Um, I'm wondering if you want to if there's anything else any other sage wisdom because you've been through quite a few stuff, right? A lot of the major catastrophes, including 9/11. You were at the university during 9/11 as well. Um, as we're working with our colleagues and in agencies, as well as supervising people, what are is there anything else that we want to know about critical incident response and ourselves and supervisees or
Um,
colleagues?
I think that for me, it really just comes down to um, maintaining a therapeutic presence.
Okay.
So I think about being with those families at the Oklahoma City bombing when um, they were told that they may, because of the way the blast was, they may not have any remains at all,
Mm,
right, for a funeral, um, for their loved one. And it was like, I don't have anything to offer,
mm,
right? There's nothing in that moment that I can say or do to make it better. All I can offer is me bringing my whole therapeutic self there
mm,
to be present and to hold that, and to create a space where if they feel like they want to talk about it, they can do that in a way that's going to be helpful to them. And
mm,
that's really, I, I I mean, there's all kinds of things that you can do, right? Like you could do some EMDR to minimize some of the responses, but I think based on my experience, it's just like they can know and tell if you're there and willing to hold that
mm.
space with
Right, right, right.
without being intrusive, right? Or asking a lot of questions, like, um, and just being there.
Okay,
Um,
right. So like who are you as the witness?
exactly.
Mm, mm.
Not very
Um,
sage, not very.
no, it's pretty sage because that is the essence of the work that we do. We can have a huge toolbox of all these things and all these techniques that we've learned, but really it's who we are and who how do we show up as that witness with that trauma um, and be in attunement with what's needed and can that person is that person experiencing the attunement.
Yeah, for
Mm,
sure.
that's really lovely. Thank you so much for joining me. I really appreciate you sharing your experiences and talking about like what was helpful.
Yeah, my pleasure.
Okay.
Anytime, Jen.
Okay, thanks.